Good day everyone, my name is Eileen Grace D. Danyan from BSN 111D. Now I'll be performing a complete bed bath. A complete bed bath is to remove the transient microorganisms, a body secretion and excretion, and also the dead skin cells. It is to stimulate circulation to the skin, and also it promotes a sense of well-being, and it produces a comfort and relaxation. Prior to conduct the assessment, I'll be performing hand washing to prevent cross-contamination and to deter the spread of microorganisms. Provide privacy to the patient. Close the window and also the door. Fix the curtains. Adjust the room temperature and provide adequate lighting, which I've already done to secure the privacy of my patient. Identifies, explain, and also assess the patient. Good morning, ma'am. My name is Eileen Grace T. Danyan, your student nurse for the day. May I see your wristband, ma'am? Please state your complete name, ma'am.
Leia Leones.
Your birthday, please.
November 10,000.
Okay, thank you. So now, ma'am, I'll be doing a bed bath, which means I'll be washing your body to remove the dirt, oil, and also the perspiration of the skin. And also, ma'am, so that you can feel refreshed. Is that be alright to you, ma'am? Okay. Offer a bedpan or urinal and ask the patient to void. Warm water and activity can stimulate the need to void, and also the client will be comfortable after voiding. Ma'am, do you want to void? Okay. So now I'll be bring the necessary equipment. So I have here working gloves, a lotion, eye drop, eye patch, deodorant, washcloth, blanket bath, and also a 2 bath towel, a comb, and also a soap. So I have here a basin and a warm water. Wear a correct PPE. So now I'll be done wearing my working gloves. Raises the bed to a convenient height and also lower the side rails near to me. Assist the client to move side of the bed. This is to avoid undue reaching and straining, and also it promotes good body mechanics and to ensure the safety of the patient. So ma'am, can you move side here? Places the bath blanket over the patient and remove the top sheet beneath and place it into the hamper. Remove the gown of the patient. If the patient have intravenous injury, line, or reduced mobility, begin removing the gown in the unaffected side.
fills the basin with 2/3 full of warm water, which is 43 to 46 degrees Celsius, and let the patient check the temperature of the water and make sure that the patient can tolerate it. Ma'am, can you put your hand here and tell me if the water it is hot or not, or it is good? It's good. Okay, thank you. Remove the pillow of the in the head of the patient and raise the head of the bed to 30 to 45 degree. Yeah. So place the towel appropriately. So the first towel, I'll be place it under the head of my patient. And the second towel, I'll be place it to over the chest of my patient. So now, wash the face. Begin to the cleanest area and work downward toward the feet. So first, I'm gonna soak the washcloth here in the basin with warm water, and I'm gonna make a badminton. And also before I'm gonna make a badminton, I'm gonna rinse it thoroughly and well. A badminton can retain a water and heat better than the cloth. So now I'm gonna wash the eye of my patient with water only, and I'm gonna use a separate corner of the washcloth for the eyes. Use a separate corner can prevent transmitting microorganisms, and I'm gonna wipe it from the inner to the outer canthus. It prevents secretion from entering the nasolacrimal ducts. So now, I'm gonna wash my patient face. I'm gonna start from the forehead to the cheek, to the nose, to the ears, and last one is to the neck. I'm gonna ask my patient if she want to use a soap. Soap has a drying effect, and face, which is exposed to the air more than the other body parts, to be drier. Mom, do you want to use a soap?
No.
Okay. I'm gonna start it, Mom. So after I'm washing the face of my client, I'm gonna remove the towel under the head of my patient. And as the male patient if he like to shave. For the unconscious patient, washes the eye with the plain water, starting from the inner to the outer canthus, and also use a new section of a cloth for the eyes, for the each of the eye. Tama lagi ito, wait lang isa. For the unconscious patient, wash the eyes of the patient, starting from the inner to the outer canthus, and also use a new section of cloth of each eye. Instill eye drop if it is prescribed, and also notice if there is no blink reflex or have a blink reflex, and if you haven't noticed a blink reflex, keep the eyelid closed. Close the eyelid gently and places the eye pad or shield. Washes the arms and the hands. Expose the patient forearm and places the bath towel lengthwise beneath the arm. It protects the bed from becoming wet. Wet soap rains and dries, then covers the axilla and the arm. And also we need to use a long, firm strokes from distal to proximal. Firm stroke from distal to proximal areas promote circulation by increasing venous return. So now, we also need to wash the hand of the patient and also the nails. And also, have the client raise her arm for washing her axilla. Can you raise your arm, ma'am? Apply deodorant or powder if desired. A special caution is needed for clients with respiratory alteration, but powder is not recommended due to the potential respiratory adverse effects. So after I am done with the other side of the arm, I'm gonna do it again on the other side also of the arm. Washes the chest and the abdomen. Spread the towel across the patient's chest while lowering the blanket to the umbilical area. Keeps the client warm while preventing unnecessary exposure of the chest. Lift the bath towel off the chest and bath the chest and abdomen with your mitted hand using long, firm strokes. Give special attention to the skin under the breast and any other skin folds, particularly if the client is overweight. You can rinse it and dry it well. Cleanses and dries the skin beneath the breast. Check and changes the water as necessary. Drapes the patient chest and abdomen using a towel and bath blanket. Expose the patient's leg farthest from you by folding and bath blanket toward the other leg, and being careful to keep the perineum covered and places the towel lengthwise under the leg. Covering the perineum promotes privacy and maintains the client's dignity. Wet soaps and rinses it and dries the patient, the other leg using the long, smooth, firm stroke from the ankle to the knee to the thigh, from the distal to proximal. Washing from the distal to proximal areas promotes circulatory by stimulating venous blood flow. Assess for any redness, swelling, or bruising or pain in the area. And also washes and dries the patient's foot thoroughly and applies lotion to the foot. And reverse the coverings and repeat for the other leg. So now I'm gonna apply a lotion to the foot of my client. Disregard the washcloth and maintains the patient privacy, refills the basin with a clean water, and changes the clean pair of the gloves, and applies perennial care as necessary. Wash the back of the patient. Assist the client into a prone or side lying position facing away from me. Place the bath towel lengthwise alongside the back and buttocks while keeping the patient or the client covered while the bath blanket as much as possible. Wash and dry the client's back and moving from the shoulders to the buttocks and the upper thigh and paying attention to the gluteal folds. Patient's skin is intact, remove and discard gloves if it is used. And also perform a back massage now or after completion of the bath if patient preserved. So now I'm gonna perform a back massage of my patient. If my patient preserved. So I'm gonna massage your back. Okay? Helps the patient to put a new gown and checks for the devices attached to the patient. I'm gonna put this new gown. Help the patient to comb her hair properly. Places the signal device near the patient and does the aftercare of equipment in order to maintain the cleanliness and orderliness of use of the equipment. So mom, if you have any questions or do you want to help, there's a signal device here and you can call me mom, okay? Okay. Perform hand hygiene. And now I'm gonna documenting the procedure that I have just done and reports for any pertinent observation.